Hello everyone, this is Dr. Brian Campbell. I wanted to talk to you today about behavior modification and how we integrate that into Christian cognitive behavioral therapy. Remember, the model that I've been presenting is Christian cognitive behavioral therapy. In fact, cognitive behavioral therapy is the most efficacious treatment of any types of disorders now if you look through the literature. That seems to be the predominant therapeutic modality. So we add Christian to that, and of course I've shown you how to do that to some extent, but I haven't really talked about the behavioral concepts and how we apply those to our Christian faith. Let me just briefly tell you that behavior modification grew out of the work of Skinner and others who worked actually with lab animals and started to develop rules and laws that seem to describe and help determine the behavior of animals. The behaviorists tend to just want to strictly focus on observable behavior. This was a reaction to psychoanalysis where everything was sort of like unobservable, and Skinner and others, and Watson and others wanted to focus on observable behavior. So behavior modification grew out of that tradition of looking at observable behavior and not trying to hypothesize anything going on between the ears. However, I will tell you that I actually use the principles of behavior modification and apply those to cognitive therapy as well. So let me talk to you a little bit about that model. Behavior modification, the rules and the laws that were derived from studying animals and also from studying human beings, usually take the form of analyzing behavior from an objective perspective, looking at antecedents, those are things that occur before the behavior occurs, the target behavior, and looking at consequences and their effect on the target behavior. So you pick a target behavior, and then I've shown you this in terms of like the client that I described who was vomiting and projectile vomiting, and how we can conceptualize that from a behavior modification perspective. Basically, the individual, when he projectile vomited, everyone moved back. When people came close to him, his anxiety level increased, and by vomiting, people moved back and his anxiety level decreased. This is an example of what's called negative reinforcement. Now we all know what positive reinforcement is. The dog sits down, you give him a bone, it's more likely to sit down in the future. Your child does something good and you reward him and you're more likely to increase that behavior in the future. However, most people get very confused with what's called negative reinforcement. Negative reinforcement does increase behavior. So it has the effect of, on the antecedent behavior consequence, the behavior increases in negative reinforcement, not decreases. Some people confuse it with punishment. Punishment, the consequence decreases the frequency of the behavior. Negative reinforcement increases the frequency of the behavior. Let me give you some examples of negative reinforcement. Some further examples. It used to be when you got into a car and you sat down, if you didn't put your seatbelt on, it went and that was a pretty aversive event. So then you would put the seatbelt on and click it and that noise would stop. Negative reinforcement is any event or behavior which terminates an aversive event or leads to the non-occurrence of that event that was scheduled to take place, the aversive event. Another example of negative reinforcement. My wife, this isn't true, but my wife would nag me, or my husband, someone's husband would nag them. The individual starts to think of going home, his anxiety levels increase, and then he decides we'll go to Starbucks instead and have a coffee, and his anxiety levels go down. That's an example of negative reinforcement. His behavior or actions switched off the aversive event, which is the anxiety inside of him thinking about going home, which is experienced as unpleasant. So that's another example of negative reinforcement. Now, the fact that he got a Starbucks was also positively reinforcing. So that behavior was both positively and negatively rewarded, so it became very strong. Another example of negative reinforcement and positive reinforcement, a child gets bullied at school, and therefore he starts to think about going to school the next day, and he starts to feel uncomfortable, his anxiety levels go up, that's experienced as unpleasant, and he tells his mom he has a stomach ache or makes up whatever excuse, and then his mother lets him stay home. Now, immediately his anxiety decreases, all right? So that decrease in anxiety is the negative reinforcement. When his behavior of staying home reduces the anxiety, the behavior is negatively rewarded. So in the future, he'll want to stay home. Now, if mother gives him cake and ice cream while he's at home, he's going to get positive reinforcement and negative reinforcement in terms of the reduction of his anxiety. Therefore, the behavior will be very, very resistant to change. And believe me, school phobias are very resistant to change. So there's an awful lot of behaviors that we can look at and change using behavior modification principles of rewarding appropriate behavior and punishing inappropriate behavior. Now, most people would not apply behavior modification techniques to cognitive therapy, but I do. I think that what we're doing in Christian counseling, from a conceptual framework, is rewarding appropriate beliefs and punishing irrational beliefs, those that are toxic, those that do not lead to mental health. So as I'm counseling someone, I'm also conceptualizing how I'm going to break up the irrational beliefs through punishment techniques and through rewarding alternative behaviors or appropriate ways of thinking. So that's another way to conceptualize cognitive therapy. You can actually conceptualize that with behavior modification concepts. So it's very important to look at these concepts. Another example I'm going to give you of negative reinforcement. I developed obsessive-compulsive disorder, very interestingly, back when I first had my daughter. Of course, I didn't think I was a particularly anxious person, although I did tend to be more sensitive and anxious than other people. So we had my daughter, and 3 days after she was born, we were watching a TV show, and actually that occurred somewhere around the time of her birth. I watched a TV show where people came in, broke in the doors, killed the kids, killed the woman, etc. And I remember my anxiety levels going up really high. Actually, Amy, the 3-day-old, was in the back in the bedroom, and I'm thinking, my goodness, that could happen in our house. And so, remember, anxiety, when at high levels, is experienced as uncomfortable. So I started thinking of that, and my anxiety went up. And so I went to lock the door, and I remember locking the door, and my anxiety level went down. Remember, that's negative reinforcement. And I felt better, so I walked away, and I thought, oh, that's good. And then, as soon as I got away, I started thinking about the image again of them breaking through the door. So my anxiety levels went back up again. So how do I reduce my anxiety levels? So I go back and I lock the door again. All right. So as you can see, I started locking the door more and more. What happens is, you can see this, the anxiety level goes up. I lock the door, the anxiety level goes down. But then I have anxiety again, and it goes back up. And basically, I am getting rewarded through these dips in anxiety that I'm getting. But overall, my anxiety level actually goes up. So I started doing this, and I was locking doors. And then, of course, I thought, well, what about the other door? So I started locking that door. And then what about the other door? And what about the windows? And I developed sort of a full-blown obsessive-compulsive disorder. Now, that's different from obsessive-compulsive personality disorder, which I'm going to talk to you about next week. But anyway, I developed that, and I had to have a friend of mine help me reduce that behavior. And I use a technique that really does help with that. Part of what he helped me with was to make sure that I remembered what I was doing. Under anxiety, we tend to forget what we're doing, so I kept forgetting whether I had locked the door. So I had to go up to the door and say, I'm locking the door is locked now, and I said that out loud. I have a client right now who taps on the door a couple of times after he's locked the door, so he has a memory of locking the door, so he doesn't have to go back and lock it again. So anyway, there's different techniques, but those are behavioral techniques applied to particular disorders, and I use those a lot when conceptualizing anxiety disorders, especially obsessive-compulsive disorder or obsessive-compulsive personality disorder. So those are some of the ways that you would utilize the conceptualization of behavioral therapy and apply it to cognition and apply it actually from a Christian perspective. I believe that God is very concerned about our behavior. He talks a lot about our behavior and what He expects of us. So I think it's very much important to utilize the best techniques we have to help people change their behavior, as well as their covert thinking change their overt behavior. Another example would be, I often in therapy get people up and out and get moving and doing things. My mother got a little depressed one time when more than a little depressed, when my father died, and she asked me what she should do, and I said, get up, get out of there, and go and do something. From a behavioral point of view, rewarding her for getting up and going out and doing something really helped her thinking as well. So there's an interplay between thinking and behavior, and very often I utilize my techniques of behavioral therapy to change behavior as well as to change thinking. So I hope this helps a little bit to look at the integration of cognitive therapy with behavior modification techniques. I know that most of you may not have had training in behavior modification. If you can, get some training. There's a great book called Principles of Everyday Behavior Modification by Keith Miller that I think you should all at least look at to help conceptualize these areas. By the way, I use behavior modification techniques every day in all my thinking. It's sort of back there. I use it for a lot in parenting techniques. If I didn't have those tools, I don't know what I would do, quite frankly. There's a lot more sophistication in behavior modification, and I wish I had time to teach you that, but I don't. But anyway, realize that you should probably get some schooling and some training and some supervision in behavior modification techniques. Okay, God bless.